there. And like last time, we are going to get up early again today. We have several lectures dedicated to biomechanics and you know, when I say lectures, class periods, some of them, you know, at least one or two will be lab based, so we'll be working on a real problem. So if you have position, you guys already answered this, but if you look at the difference between two positions, you get distance. So two positions, you get distance. If you look at it over a distance over time, you get a velocity. If you look at velocity over time, so basically your velocity is changing. That's the idea there. You get acceleration. If you add in mass, or rather multiply by the mass, and then if you, we'll go on this side. If you look at, now in the equation, it's R. It says it's, when we think of trigonometry, there's a lot of it that's based in circles. And so we say R, even though we may be talking about, you know, fulcrum with a lever. It's the distance from that fulcrum to wherever the mass is. So you have a baseball in your hand that you're going to throw. Most of the mass is here, but in biomechanics, we have ways to estimate the mass of your forearm, for example, and your upper arm. Anyway, so this is the radius, and if this is at an angle, then this is our theta. So if we include radius and the sine of theta, depends. Sometimes we don't use sine, we use, has anyone taken trigonometry? Nobody? Okay, that's okay. Like I said, we won't get into it. If you ever do take it, you just remember SOHCAHTOA, and that'll, when you learn that, then you'll be like, oh yeah, that explains it all basically. That's the fundamental. If you look at the distance and the angle, then you'll get a torque. So that's what's here. Position to a distance, to a velocity, so distance is missing here, but acceleration, you add in mass, then you get force, and if you add in, so it's sometimes referred to as a moment. That's they're the same thing. If you hear either term, it's the same thing. And I don't know who's in that picture, but all right. There are three primary ways to cut your body in half. So there's anterior. It would be like this. If you were to slice a cadaver in half, we'll talk about some things that are a little bit, they're cheery. How about that today? If you were to cut a body in half this way, that is the medial cut. And then this way is the sagittal plane. So there's anterior, medial, and sagittal. Which one is one where you get a mirror image? So one of them would produce a mirror image of a body, and the others would not. Anterior, good. So straight down the middle in the front. some other things that are important. So I'm gonna just list. So if it's like it's a different one. I think it is. So we have different planes. We just reviewed them. Anterior, the medial, sometimes lateral, and then sagittal. There are also terms relating to the position of the body. Okay. There's caudal, and there's, which is kind of a weird word, and there's dorsal. Caudal is the front side, and dorsal is the back side. If you think of like a dorsal fin on a shark, so the dorsal is the back. This could also be called the anterior view. There's two types of movement. So this is the anatomical position, which I don't know why. It was during the Renaissance and Enlightenment that people started. I was listening to a podcast, and this wasn't the main topic, but it was like mentioned that people started that, like, that's the time period when people started cutting up dead bodies to like learn about anatomy, but which before that time was not allowed. So there was a lot that people learned by just cutting up dead bodies. Anyway, where was I going with that? Well, I don't remember who it was that decided that this is the anatomical position, but it's basically with your feet together and your hands, your palms facing outward to the front, with your thumbs outward. So this is anatomical position. So anything on this side is dorsal, on this side is palmar, anterior. Anything, so I said that wrong. So this is anterior or palmar, and that's dorsal. Anything towards your head is cranial or superior. Anything towards your feet is caudal or inferior. There's also abduction and adduction. Is anyone familiar with when you think of something like, think of aliens? If you're abducted by aliens, what does that mean? What happened to you? You got taken away, right? From your bed, or I don't know, wherever. Abduction with a B as in Bravo, means your limb moves away from anatomical position, but away from your body, your core. So this is abduction of your arms, and this is adduction. Think of it as like you're adding it back to your body. We may or may not use all of these terms, but it's good to know, be familiar with them. Depending on how you rotate your wrists, your forearms, there's a term for that. So this is pronate, and this is supinate. Actually, I lied. I'm remembering from medical school. So supination is like this, and the way that we remember that is it's like you're holding soup in your hand or something. Anyway, so supination is with your hand, the palmar side forward. Pronation is with your palm down. Let's see. Okay, one last thing. There are two. We talk about bones. We talk about muscles. We're going to today. If you are talking about, say, your humerus, there's an end that we call the distal end, and an end we call proximal. Which one do you think would be which? What would be up by your shoulder, distal or proximal? And why do you think that? Does anyone know what the root word of proximal means? Or trying to think of an example to help remember that, and I don't know. If you say approximate, I mean, that's from the same root word. It means it's close to that, right? It's about that. So proximal means it's close to your core. It's closer to, so the reference is to your core body, or either close to your core body or away from your core body. So which would this be, the distal or proximal? This would be the proximal. So this is the distal, think of it as being distant from your core body. Be familiar with those. And the class before the exam, we will have a review. We'll go over things. I'll make sure that we review every topic on the exam. There should be some study questions as well posted on Canvas in case you want to get a head start. Of these tissues listed here, which would you consider hard tissue and which might be soft tissue? So we have bone, cartilage, ligaments, tendons, and muscle. And if you know one is one or the other, then that's fine too. What would bone be? Would that be a hard or soft? It's a hard tissue. Cartilage, soft. Ligaments, ligaments are soft. Tendons are soft. So everything else is soft. And to be honest, when it comes to injuries, sometimes hard tissue injuries are easier to heal and get over than soft tissue injuries. Has anyone, especially those playing sports, had any injuries where you, so what did you injure? Okay, the joints themselves? Okay. Okay. Oh, wow. So tell us what exactly the injury was, what the treatment was, and how long that took.
Mine was kind of complicated because I fractured my left ankle and I didn't know that I fractured it. I just sprained it, so I didn't get it.
That's not good.
Yeah, so it still has problems.
Okay. So, wow, yeah, that's interesting. So, what kind of treatment did you have, and was it a long treatment, or did you? Wow. Okay. So that is kind of complicated. If you had known that you broke your ankle, it would have been a faster turnaround. Yeah. Okay. And you had an injury?
Yeah, I tore my ACL, sprained my ACL, and
ouch.
Yeah.
So what is the treatment for that, and how long did it take?
So basically, you just do a lot of physical therapy. I had surgery done to repair it. They took part of my patella as my new ACL. And then, so before I had my surgery, like a month before I had my surgery, they just basically did stretches so I could get as much motion done, like range of motion done to my knee as possible before the surgery. So after surgery, it was easier to get the range of motion back. And I mean, like, I still feel it, I guess, but I stopped. I wanted to get back to playing, so I stopped by like 6 months after it happened.
Okay.
I think it's anywhere from 6 months to 12 months. You're supposed to do keep doing physical.
Well, that's those are more serious injuries when you. So what is the ACL called? I mean, what does it stand for? Anterior. So that means it's on the front side.
Yeah, both legs.
You said you tore it. Now,
Yeah.
is a tearing like a shearing, or just like, is that a partial or a complete tear? I guess.
No,
I don't know.
it was like exploded like it just.
Yeah, ouch.
Yeah.
So yeah, I mean, those types of injuries, yeah, you are looking at months, maybe even years for recovery. Usually, it kind of depends, but generally, a hard tissue injury is going. It's a little more straightforward, and our bodies are able to take care of that within weeks. So we're looking at weeks, whereas a serious, like, you can break a bone and in weeks you're back. With some, I mean, especially ligaments, tendons, or muscle, if you tear those tissues, you might be looking at months or even more for recovery. So in some ways, these soft and squishy tissues are harder to deal with. Our skeleton has multiple functions. It gives us support. That one's pretty obvious. Protection. What are some examples of how our skeleton protects our body? Yeah. Okay. 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 The skull. Yeah. Our brain's so important that we have. It's like, well, some of us may have thicker skulls than others, but yeah, it gets its own. It's like encapsulated in bone, rib cage. So that is an important area. Most other parts of your skeleton, your appendages, are more for support and movement rather than for protection. So those are good examples. Red blood cell formation. So bone marrow, that's where red blood cells get created. Trying to think where they go to die when they're done, when they've served their, I think, they probably get, sent out with the trash like everything else. Calcium storage as well. So if you have excess calcium, it goes to bone to be stored. Kind of like with proximal and distal muscles have their own terms, although they're not in relation to your core body. Simply where, let's use an example. Your bicep. When you contract your bicep, what happens? I think of someone doing curls in the gym. What are they doing, basically? So your forearm is being abducted towards your body. So it's coming up, and I guess maybe it moves away first and then it's coming back. But if you do the full range of motion, then eventually it comes back. So does your forearm or your upper arm move if you're doing curls? I mean, there are different curls, but in general, which one is the one that's moving? Your forearm, right? So your bicep inserts on your forearm. Its origin is on your upper arm. So the origin is the part that doesn't move. So it originates in the upper arm on the humerus, and it inserts on the forearm because that's what's going to actually move. So that's what those mean. There's the belly of the muscle. What do you think that refers to? Think of the bicep. Just the main bulk, right? I don't have enough bulk to show, but maybe some of you guys do. And then there's the tendon. So we didn't talk about the difference between ligament and tendon, but what is the difference? I know some of you know, so I can make you tell us. What's the difference between a ligament and a tendon? So, say it louder. So one is bone to bone, and the other is muscle to bone. So the anterior, is it cruciate ligament? What is that connecting? So it's ligament is bone to bone. So what two bones is that connecting?
I don't know, whatever the bones are.
So yeah, I guess I'd have to look it up, but it's the femur to probably the tibia. So our lower leg and our forearm both have two bones each. And sometimes I forget, but for your lower leg, it's the tibia it's the biggest and definitely the most important. It provides the most support. I actually, it's the fibula is the other. I don't really know what it does exactly. I mean, it's there, but it's it's not very big in comparison. It doesn't do. It's not much for support. I know it has a purpose, but everything has a purpose. In your forearm, you have the radius and the ulnar. The radius is on your thumb side. It tends to be a little more important, but they're both similar size. Anyway, so tendon is muscle to bone. We have three main types of muscle: smooth, cardiac, and skeletal. So where do you think the cardiac muscles are? There's only one spot. Yeah, in your heart. That one's pretty straightforward. That's nice. What about skeletal? Those are actually also straightforward. So where are those going to be? They're generally what we think of when we think of muscles. So all of your appendages, even around your trunk and core, you're going to have skeletal muscle. So those are muscle does provide some protection to your inner core and your organs. Obviously not as much as bone, but it does do that. It's for movement. And then smooth. So, the slide says lines the hollow cavities of the body. What are hollow cavities of the body? Okay, good. So you got your gastrointestinal system. There are some others. So your arteries also have muscle in them, and that is to help get the blood where it needs to go. So if you think about it, so the heart isn't alone to move blood, say, against gravity to your head. The arteries also have muscle, but those are smooth muscles. You can't consciously control them, just like you can't control your gut muscles, your smooth muscles. And the same with cardiac. We don't have conscious control of them. They do their own thing, hopefully, and all is well. So skeletal are the only ones that we can consciously control. And within skeletal, there are two types. Type 1, which is also referred to as slow twitch, and type 2, fast twitch. One type is good for endurance, and the other type is good for force and power. Which do you think is which? Good. So slow twitch or type 1 is good for endurance. So if you think of a marathon runner, they're not necessarily that they have more slow twitch muscles, but they're certainly going to have, what's the right word? Their body will have developed those, and they'll be more emphasized in their physiology than fast twitch. So if a marathon runner has slow twitch, then what kind of athletes might have fast twitch? Good. Yep. Sprinters. So if you think of running like a marathon runner, then the 100-meter dash is going to be fast. So if you ever look at a sprinter side by side with a marathon runner, what is their physique like? Mm-hmm. And the marathon runner, right? It looks like they haven't eaten in a few weeks or something. No, just kidding. Yeah, they're usually very skinny, and a lot of what you do see, the little bit that's there, is slow twitch muscle, whereas with a power runner, they're gonna have a lot of fast twitch. This is interesting. High vascularization means that slow twitch muscles tend to have more blood. That's what that means. So vascularization means there's more blood going to that area, which I find interesting, because usually if you see someone who's really ripped, you can see their arteries and veins bulging. Now that you will get, as you do resistance training and work out, you will get more vascularization than you had before. So if you are ripped, then you'll have more arteries and other vessels. And it's not that you have more necessarily, but they're larger. They've expanded. So you'll have more blood going to your muscles than you did before. But in comparison between the two, type 1 muscles have a greater amount of blood per fiber, per muscle, than power, which is interesting. You don't usually think about that. And like the name says, type 1 contracts slowly, whereas type 2 contract quickly. Real quick, if you think of, say, a lot of the animals in just, I guess I'm thinking of, like a natural predator, like I'm usually thinking of a mountain lion or something. If I'm hiking out in the woods, what am I going to do? That's one thing I think safety has kind of ruined me, because if I go to a public place, then I'm thinking about, okay, where's the nearest exit? Where's the fire alarm? Like, I'm thinking about all those things, and that's good. It just makes it harder to relax and enjoy the public event or whatever. Or if I'm hiking in the woods, I'm thinking, okay, if I come in, if this happens, what am I going to do? And one of those that I think about is a mountain lion. And I used to think, oh, I'm gonna put up a fight. But what type of muscle do you think an animal like a mountain lion has a lot of? They have a lot of type 2. And really, I don't know physiologically, but I would imagine they're like on another level. So we humans are, compared to animals, we're pretty weak. Now, that doesn't mean you can't put up a fight against a mountain lion, but chances are you're going to lose, especially because they have, claws and teeth and stuff like that. Unless you have, our saving grace is our brains and our, guns or whatever, bear spray. But anyway, we actually, we are pretty good at endurance compared to a lot of animals. A lot of animals are built for power and speed, but we could beat them in a marathon. Not that that's very helpful, at least most of the time. All right, so some muscle anatomy. This is microanatomy. If you look at muscle fibers under a microscope, one that's strong enough, you'll see these striations or these stripes. And those stripes correspond with different parts of the anatomy in a muscle. And it's hard for you to see because this is so small. But there are 4 main zones on that fiber that we're interested in. Well, some of them are zones, some are not. Some are just called lines. So there's the Z line. We'll talk more about what this means, but Z lines are where actin is anchored. I bands contain actin only. A bands is where actin and myosin interact, and then the H zones only have myosin, and that's what shrinks when the muscle contracts. And that's not, it's not a very thorough explanation. So let's talk about this a little bit. A little bit of a side note. Does anyone know how snakes actually move on the ground? It was kind of a mystery for a long time, until a guy got a high-speed camera and in a lab was like, zoomed in on the belly of a snake as it was moving along. Because otherwise we were just like, yeah, they kind of like wiggle, I don't know, slither, but we didn't know exactly how that happens. So the guy, he had a high-speed camera so he could look at it in slow motion, and he's found that they basically walk. It's like walking, but they have, thousands of little feet. So it's basically, the scales are just, it's like walking. So they walk, basically. They just don't have legs like we do, which I thought was kind of funny. So let me get another color. Actually, I'm going to do it on this side, just so I'm going to make sure I get this right. So with muscles, we have these strands of myosin. Just draw a couple. Let's put the anchor here. And then we have these filaments that overlap with the myosin. Now you can see these anchor. Be familiar with the names. I know it's kind of like learning a new language, basically, with these names. It's more important that you know the basic idea of how this works rather than the names, although that's just, the names are how we refer to the process. So basically what happens is, well, let's label some stuff here. So we've got the Z. Because we have a bunch of actin coming together here, under a microscope, this looks thick. Like we can see a line. This is the Z line where the actin anchors. So because it's all anchoring, we can kind of see that. The M, where these bundles are in the myosin filaments, it looks, you can see a little pink or red line there. And that's, we'll label that M. That's not part of the slide, but that's okay. There's also a little zone where if you had another set of these on this side, there's no myosin, and that's what has this lighter color here. So this is I. They call it the isotropic bands, where there's only actin present. And this area here where you can see the red, that is the A bands, or the anisotropic. I want to make sure we get all of these labels. So H. Well, so this would be, this band here would be H, or zone, H zone. All right, so basically what's happening is there are little arms on both. And we'll talk about some of the more of the physiology. This is just kind of the actual anatomy. But the way our muscles contract is kind of like climbing a rope, hand over hand. And that's what's going on here. So the actin and the myosin arms come together and they pull. So that if you were to see this happening, these the actin filaments and these zones, the Z zones, Z lines would come together. So hand over hand, they're pulling on each other, and this closes in. And a whole bunch of that happening is what makes your muscle contract. So this would be just one little unit in your muscle, but you'll have thousands of them in the same fiber, and all of them doing that together, pulling, makes your muscle contract. Talk a little bit about neurons. Know that this is the axon, so that's the main unit of it. This is the axon. This is the nucleus. Our axon is the long part that travels. Some axons in our body may be meters long, so they're really long. They would probably leave your brain and go, go somewhere like through your spinal cord, for example. And then you have your motor end plate and the muscle. So you have a synapse here. You have synapses here where the neuron gets signals from other places, other neurons. Once it reaches a certain threshold, it'll send a signal down the axon to the muscle to tell it to contract. We won't worry too much about the microanatomy of the neuron. Are there questions? Okay, we're gonna go a little bit more, a few more slides today. So we talked a little bit about some of the risk factors for a musculoskeletal disorder. Some of them are genetic. There's not much you can do about it, unfortunately. And what morphological means is shape. So morph, what is the word for, like, is there a term for a shapeshifter? I'm thinking of like fantasy things, but trying to remember where we commonly use the word morph. Anyway, morph means shape. So it may be just that the shape of your anatomy puts you at risk. Hopefully that's not the case, because there's not a lot we can do about it except to try and accommodate. Psychosocial, thoughts on what that means? So it has two parts to that word. Let's break it down. Psycho and social. What would those words refer to? Okay, good. So your psychology and social environment. So in ergonomics, we often think of the physical environment, and that's what we think of first and most. But our social environment and our psychology will also affect our risk for musculoskeletal factors. So I want you to imagine Imagine you have a high-risk occupation and you hate your job. Hopefully you don't find yourself in that position, but you hate your job, you hate your coworkers. I'm using strong words here, but you don't like it at all. You hate going to work every day. You think you might be at more risk for hurting yourself than if you loved your job? You will be. And you know, some of you know more about psychology than I do, but it's amazing the strength of the relationship between our brains and our physiology and our bodies, and the effect that what's going on up here can have on the rest of our body. So stress is a risk factor for lots of health effects, lots of diseases, and that's one of those areas where we're starting to realize and kind of wake up to the fact that maybe we're overstressed sometimes. We can produce productivity, reduce, what did I say? We can increase productivity and reduce injuries and negative outcomes if we find the right balance of stress. You have to have some stress is healthy. We'll put it that way. Some stress is healthy. If you have too little or too much, that's where you have problems. So we aren't going to talk much about psychosocial. I'm talking about it right now. That's basically what it's going to get. But I agree with those that find it to be important. Biomechanical. So this is what we talked about yesterday. Ergonomics is often broken into two pieces, biomechanical and then the physiological. So this has to do with pacing and frequency. If you, let's say you're machinists in, we could say at Ruger. So you're machining rifle and gun parts, and you're not paid. You're not paid by, you don't have a salary. You're not even paid by a wage per hour. You're paid by piece that you produce. Do you think you're going to try to produce more in the day? Yeah, most people do. You go to work to make money and to hopefully find some sort of satisfaction in your work and enjoy it. But generally, we want money. So this is where the organizational system or structure or design could affect risk factors for musculoskeletal disorders is if it's a piece rate. So for every widget or every rifle part that you produce, you get $5, let's say. So, or I don't know what they would pay, but anyway, that's an incentive to work faster and longer, which, it's not all bad, but it can lead to people overexerting themselves, doing too much physiologically. And, the whole repetitive motion thing that was brought up yesterday, those things with the biomechanical, we're talking about the mechanics of the body. This bone is connected to that bone. It's a lot of about the skeleton. When I don't know who names, it's probably clinicians who name these disorders because they're the ones who recognize new stuff first, but maybe they have ergonomists help them with it. I don't know. But generally, the name will have some of the anatomical or joint or body region characteristics in it. If you can't see this list. If you look at the slides, then you'll be able to see it. But rotator cuff tendonitis. What do you think that's talking about? Even if you don't know what the rotator cuff is, okay, it's the tendon that's attached to the rotator cuff. And what does itis usually mean? It's a little bit of medical terminology. let me think of one that, yeah, inflammation. Good. So just by reading that, okay, this is a tendon that attaches to the rotator cuff and it's inflamed. So tendinitis is a tendon that's inflamed. Let's find a different one here. One that some of these are kind of weird. Flexor tenosynovitis. Okay, that's kind of a mouthful. Flexor, what do you think that would refer to? So I'm not super familiar with all of these on this list, but just by the name, you can kind of start to figure out what it's talking about. Flexor. What's the opposite of flexing a muscle? Or so extending. So if I flex my bicep, my tricep is actually extending. If I flex my tricep, then the bicep is extending and the tricep is contracting. So flexor means it's a muscle whose function is important in flexion, probably of the wrist if we're talking about the forearm. Teno. Now they've kind of crammed a bunch of words into this name, but teno tells me this is a tendon. Sino is a term that refers to a joint. And vitis, flexor tenosynovitis. So I know that we have inflammation of a tendon possibly and a joint of a flexor muscle in the forearm. Those are just some examples. Shoulder tendinitis. You can kind of guess what that one is, right? Some of them are a little bit more different and strange, or they'll have probably some dude's name attached to it who first discovered it. Like the Quervian syndrome is that's actually a common condition, but apparently some person, probably a dude with the last name de Quervian, discovered it, or was the first to kind of characterize it. So this is an example of locations on your arms and hands that are innervated by different nerves. So basically, if a single nerve comes down from your neck or your spinal cord, will leave and it will innervate. That means it goes to this part of your upper arm and shoulder. So the radial nerve comes down and it takes care of the sensation and everything for all of this part of your arm. The lateral antebrachial cutaneous nerve, you don't need to memorize all these. Just know that nerves travel to different parts of your body and they'll take care of different parts. And depending on where you're getting pain or irritation, you might be able to determine what nerve it is that isn't happy, that's unhappy. Sometimes nerves will get compressed and they won't be happy. Can anyone think of nerves that maybe you've had, or someone who's had get compressed or squished just when they sit or are moving around? Let's see. Okay, where does the sciatic nerve go? So it is a common one where, people have issues, and we're not going to look at it, but if you look at where the sciatic nerve goes, you think, why does it have to go through right there? Because, if you're flexing or extending your hips much, you can see how just the pelvis, so the bones for your hips, is a Greek word. The pelvis is a Greek word that means funnel. And if you think about it, you've got a lot of stuff that comes down to your hips, and the nerves are funneling down, and arteries and stuff are funneling down to your legs. and you have your guts that funnel right there. Anyway, it means funnel, but you got a lot of stuff going through your hips. And unfortunately, the sciatic nerve is right in a spot where it tends to get irritated from lots of hip flexion and stuff, or just sitting for long periods. So that's a good example. And if you are, if you're compressing that nerve, then I don't know where it goes to the legs, but you may have pain and stuff in those locations, even though the compression is happening, up in your hip. So here's so carpal tunnel syndrome is a really common MSD. If you look at a cross section of your wrist, so if you were to chop it right there, you'd see this bundle of tendons and nerves and vessels coming through what's called the carpal tunnel. So you have there's a sheath that covers it to give a little bit of protection and also keep them all in line. So there's the median nerve that's inside it. You actually have a couple of nerves that sit outside of that sheath. You have bone surrounding the backside. So this side usually isn't, at risk because you have bone there. But you have all these soft tissues right here. And you guys can tell me what often leads to carpal tunnel syndrome. What are some examples? Okay, so typing a lot, that will cause carpal tunnel for some people. Any other ideas? Thinking of music, has anyone heard of someone with carpal tunnel from playing a certain instrument? That's possible. I haven't heard of that, but I could imagine if you're doing a lot of piano, you could get carpal tunnel. I'm thinking of the violin, because they have to, like, I've never played it. Has anyone played violin? So, like, your wrist is kind of... Yeah, so you're holding, it's static, but you're also using force, and you do move it as well. So violinists get carpal tunnel. There are multiple things that could lead to it. Basically, though, what's happening is you're getting inflammation, which means you're irritating these tendons and perhaps the sheath. And as they swell, they squish the median nerve in here. And it doesn't like that. It hurts. And anyway, so I want to do a study. So we'll be done for today. But every time I go to Walmart, I'm not going in the self-checkout lane. If I'm actually having a cashier check me out, I look at their wrists, because I would imagine, I don't know, 20% of the time, my cashier has a wrist brace on. And I usually ask them about it, but I guarantee it's from scanning lots of food and stuff for their job. And I guarantee they're probably having some sort of issues related to carpal tunnel syndrome. And that's the whole goal, is we want people to be able to do their job and make a living without having to deal with that kind of stuff every day, without having to get not that paying for a wrist brace is that much of a hardship, but trying to do your job with that on because you have pain, that's unfortunate. And that's what we want to prevent. Any questions? All right, thanks. Have a good weekend.